250 years ago, there was a war being fought between the newly formed United States and Great Britain for independence. And as dangerous and deadly as that war was, there was another war going on. A war that was 10 times more deadly to the American soldiers, more deadly than the British bullets, bayonets, and cannonballs. That battle was being fought against disease. These diseases included typhus, smallpox, dysentery, pneumonia. They were the real killers. Right now, streaming on PBS is a 12-hour documentary called The American Revolution by Ken Burns. Make sure to check it out. It's hard to imagine how primitive medicine was in the 18th century. In that time period, medicine was still fairly divided between internal medicine and surgery and surgical procedures. The physicians, the doctors of physic, were the very high-class doctors. They treated rich people. The surgeons were one step above barbers. They were treated as lower-class version of doctors, and they weren't paid very well. Interestingly enough, though, the surgeons were actually ahead of the internal medicine doctors of the time period, because at least their surgeries tended to work out all right. As long as a patient didn't get an infection and die, they did have some surgical techniques that would get them through for simple things. Maybe not a wound to the abdomen or something is happening in the brain, but for the rest of the body, they had some ideas about how to fix that. But most of the internal medicine of the day, if they had effective medicines at all, they were truly poisonous. So you were just as likely to die from the medicine that they would give you as from the disease that they were trying to treat. Now, it's not a completely bleak story. There is a book that comes out in 1775 and 1776, printed in America specifically for naval and army surgeons that were going to be in this brand new war. And it's a book by Dr. John Jones, and he was really speaking to these brand new surgeons. He really wants to help the whole medical field. And he was an actual teacher in the second medical college in the colonies. He thought that, number one, the medicine, the internal and external medicine, surgery and regular physic should be together as one. Doctors should know both of those things. In fact, he had this great list of things that the doctors should know, languages and anatomy and chemistry and all these things. Just a great book. And at the end of that book, he has a whole appendix where he's talking about the design of hospitals. Because hospitals of the day were the places where you would go to hopefully get well, but more likely die of some kind of disease. In fact, many doctors thought that hospitals were the worst place any sick person could ever go. And that was certainly true during the Revolutionary War. But Dr. John Jones, he had some ideas about how to treat wounds, how to design these hospitals, the best way to treat the actual patient, and he was really concerned about medical care and specifically about sanitation, which was such a critical part of keeping disease at bay. For all the forward thinking that is in Dr. John Jones's book, there's one interesting thing that I noted. There was a technique in the 18th century for bleeding. You would cut open a vein and you would bleed the patient a pint or possibly a quart of blood to try to treat them. Now, never in Dr. John Jones's book, for any particular ailment, did he think that bleeding was bad for you. It was always a case where you could bleed them, maybe you should bleed them more. Doesn't matter whether it was for a gunshot wound or for some other kind of internal problem. Bleeding was one of the most popular treatments in the 18th century. That leads us to the battlefield. Dr. John Jones speaks specifically of dealing with patients that have been injured in battle and what you need to do first. And his greatest concern is to deal with the bleeding, dealing with the hemorrhaging. He knows that if you don't treat that first, the patient is likely to die before you can do any other repairs to them. So he speaks to that in his book. And the battlefield conditions and what's happening with the wounded in the 18th century is so heartbreaking. Many times the soldiers, there is no set way of dealing with the wounded on the battlefield. How do you take them to a field hospital? They had wheelbarrows and simple stretchers, and that's all they had. There was no specific ideas about how to deal with that. And there were times when the wounded would lay on the field all day and all night, and they were in such agony that they didn't even want to be moved at that point. They just wanted to be left alone. Now, there might be cases where that was the best thing for them, but not really. They really needed to be cared for in some kind of a way. They did have a system of field hospitals, maybe a 3/4 of a mile back from the front lines, so that it wouldn't be there in the midst of the battle, but men could be cared for basically right away. And the idea was that they would do just the minimal work on the men, get them stabilized and move them back even further to better medical care. But that's where the real problem is happening. The real centers for death in the time period were the large military hospitals. There was a lot of overcrowding, and that overcrowding brought disease. This was the true killer in the 18th century, overcrowding. So many of these hospitals were designed for 300 or 400 men, and they would have twice that number in that location. And if you're not on those sanitary situations, disease, specifically typhus, would go through the hospital and kill half of the patients immediately. We have a surgeon's diary from right at the beginning of the Valley Forge experience. This is going into the winter of 1777, 1778. And here he's talking about the typical soldier that he sees. Here comes a soldier. His bare feet are seen through his worn out shoes. His legs are nearly naked from the tattered remains of an only pair of stockings. His breeches not sufficient to cover his nakedness. His shirt hanging in strings. His hair disheveled. His face meager. His whole appearance pictures a person forsaken and discouraged. He comes and cries with an air of wretchedness and despair, "I am sick. My feet lame, my legs are sore, my body is covered with this tormenting itch." This is the typical soldier who's the healthy one, not the one who's sick yet necessarily. He does talk about having the itch. Another massive problem within the camp are scabies, a constant problem with everybody itching and scratching. They've got lice, they've got fleas, they've got every other kind of problem. You can see how a soldier might be happy to go into battle compared with the difficulties that he has in camp and with what might happen with disease if he stays there. Medical care is one of the foundation stones of having a military. How are you going to keep them healthy? The Continental Congress knew this was going to be an issue right from the top. And about the same time that they assigned George Washington as the commander-in-chief, they also assigned a medical general, basically, to cover what they called hospital, which was the entire medical corps. And at that time in the colonies, there were 3,500 doctors, and only 400 of them had graduated from any kind of medical school at all. So you can think most of these doctors were just apprenticed. They assigned the first doctor general to the army, and within a few months, even before 1776, there was a problem. It turned out that he was a traitor. He was sending letters, ciphered letters to the enemy. And so he was tried and convicted for that and thrown in prison. They had problems directly from the get-go with the organization of the doctors and medical care in general. It was a struggle throughout the war. The second medical general had problems with authority. He wanted lots of authority, and he had a problem getting people to stand behind him. And he was relieved of duty in 1777. The third medical general did also have problems and was tried also for malpractice, basically. It wasn't until 1781, at basically the end of the war, when they finally got a competent doctor who could deal with some of these supply issues and organizational issues. If you love documentaries, military documentaries that are in-depth, Ken Burns has a new documentary called The American Revolution. It's on PBS and it's streaming right now. We've heard about the gruesome conditions. We've heard about the terrible diseases, and we can imagine what those battlefield conditions were like. We've heard about the difficulty in organizing the people, and we know that the soldiers had a great lack of equipment, lack of clothing, lack of food. It's amazing when we consider all these factors, and then we realize that yes, we persevered in the War of Independence. Yes, those men continued to fight even under those conditions, even as the doctor was describing that soldier. Can we imagine him getting all the way through that war and winning? But that's exactly what happened. What an amazing circumstance that we can look back in history and see a picture of these soldiers and what they had to live with.